This is an unprecedented and extremely difficult time. We're facing challenges we've never faced before, including here in the United States, where the health system has been overwhelmed in some places. I'm extremely concerned of what this means for the developing countries, particularly Africa. And I have no doubt everyone listening to this working tirelessly to is working to respond, particularly our health ministers, along with other sectoral ministers, and many are taking a whole government approach. While there have been far fewer cases on the continent and most low and middle countries compared to places like the US and Europe, we see the numbers growing. From what we know now, this country seems to be just at the beginning of this epidemic. So this is both good news and bad news. The bad news is that we can and must expect to get it much worse. The good news is that we have a window of opportunity, although it's narrowing, to prepare our response. So regarding how to respond, I'm not probably saying anything new here, but we need to try and get ahead of the pandemic. We know that social distancing has been the order of the day. You know, many countries like Ethiopia, like my own country, our economies are informal. We require human-to-human interaction. Many live either in the informal settlement or multi-generational houses. Really, the idea of social distancing and hand washing, which seem to be really accessible in the West, may not be practical solutions for many in the continent of Africa and Asia and Latin America. So how do we then deal with this? So as my good friend Tom Frieden, from former CDC director and now the head of Resolve, in pushing, he has come up with a term called boxing, right? We need to box the pandemic. We need to test, we need to isolate those who test positive, we need contact trace and quarantine those who come in contact with someone who's sick. So I'm personally working very closely with African CDC and many others in the continent to really try and scale up testing as quickly as possible. But there are huge gaps today that we need to solve as quickly as possible. Second, we need to ensure that any response puts the most vulnerable at the center and consider how this pandemic is affecting women and girls in particular. The pandemic is causing hardship for millions. We're seeing this. We now have over 3 million people infected and over 220,000 deaths around the world. And from what we've seen, men seem to be disproportionately facing serious illnesses and death from COVID itself. And that at times can be deceiving, because what we know for sure is that women and girls bear the disproportionate burden in times of crisis. And we are now seeing the widespread and profound impact that COVID is causing already. So for example, WHO, there are many entities, the Global Financing Facility, and many others have come and said sexual and reproductive health services, including access to safe abortion, to be part of essential service during COVID. But we know that there are significant gaps emerging. We've also seen things like spike in domestic violence for women who are trapped with their abusers. So in this way, the pandemic is so much bigger than just the virus itself. So it's going to require a response that's much bigger than the virus. In the long term, the pandemic underscores what we already know, that it's critical and urgent that we prioritize building a very strong, well-functioning and resilient health system that delivers for all. We've been talking about health for all for a long time, since the Almata Declaration that has now been around for over 40 years. So how do we really ensure that translates from just being a speech and a global mantra to reality? We know that many countries are putting all they can to creating resilient health systems, yet we are far, far away from reality. So this pandemic reminds us how we must really continue to translate that global momentum for universal health coverage and primary health care into reality on the ground so that many more lives are not lost senseless. And we need to make sure that the systems respond to the needs of the most vulnerable, which includes children and women and girls, marginalized communities. And finally, such unprecedented global crisis is going to require particularly bold and courageous leadership. As the Director General of the WHO, Tedros, has continued to remind us, we are in a moment where we need solidarity more than ever. So it's going to be so important that we band together, that the virus knows no borders. So our response must be coordinated and done in solidarity. Yeah, I said before, getting ahead of the virus as much as possible will be critical. In doing so, flatten the curve, right? What means is that we're not overwhelming our health systems. And if we flatten the curve and patients are not arriving all at the same time to the health facilities, the health centers, which means we're not exposing our healthcare providers to a very overwhelming level of patients that put them at risk. Again, further contact and identifying the case is going to be key for positive outcome. We know that the global supply shortage of protective equipment is a huge challenge, and we're seeing even here in the US in best resourced hospitals, frontline providers are struggling in getting basic things like gloves and masks and goggles. So you can imagine how this is going to be much more exaggerated for those that are in low resource setting. In Africa in particular, we need a very coordinated continental response to tackle this so that we can harness the buying power of the continent as a whole, and that individual countries are not going to be pitted and putting their limited resources to getting overpriced PPEs. The African heads of states have designated Africa CDC to coordinate a continental response to addressing COVID. We are working very closely with them to ensure that PPEs and testing kits and other things are getting to the continent and being distributed, being both acquired and distributed quickly and equitably. We also need to acknowledge that the majority of frontline health workers are women. Over 70% of the workforce worldwide are women. For example, when sex aggregated, gender aggregated was available through the Global Health 50/50, what we early China experience was that 90% of the frontline responders in Hubei province were women. So this really underscores the need, important it is to consider gender dynamic of this pandemic response. And although we talk about how men are disproportionately affected, women are disproportionately exposed, both in terms of being providers of their family, but also being frontline health workers. So, and when we get into this, for example, when we get to things like masks, where we are trying to weigh the debate between how to use them to protect communities, especially the evidence now that there may be a component of aerosolized virus. So people who are sick, the initial recommendation from the WHO was that given the shortage, masks need to be reserved only for frontline workers. Now we are learning that especially for the communities that can social distance, masks may have benefits. Cannot underscore enough that masks like N95 masks need to be preserved. While surgical masks can be used at the community, masks like N95 that are highly protective need to be reserved for frontline providers who are having repetitive risk of acquiring this virus. Absolutely. If I have not been clear, let me be clear again. This is already happening. In fact, I'm part of the Global Financing Facility Investors Group at the World Bank, and we have issued a statement because we are seeing a sliding back of services when it comes to maternal health and women and sexual and reproductive health and services. So women's health and rights are already in jeopardy when we even have pandemic, and this crisis is making the situation worse. Really, never has it been more important to ensure women and girls and their needs are prioritized than this pandemic. This is particularly true in countries, as countries respond and consider that the services, countries right now have the unfortunate reality of having to prioritize services. What goes in the essential health service that must continue and what gets deprioritized. So my urge to the ministers is that sexual and reproductive health services must be considered part of the essential service package at the time of this crisis. We saw this during Ebola, both in Liberia, Sierra Leone, and many countries, as well as DRC, where the pandemic took hold and that became the priority and the services were deprioritized. We had seen a wide increase spike in unwanted and unplanned pregnancies, as well as high rate of maternal death. And this, African countries and Asian countries, particularly where have deep relationship and understanding of the system in sub-Saharan Africa, we've made enormous progress in curbing maternal mortality. And if we don't look at these things right, and if we don't avail services such as, safe delivery, services for sexual violence, family planning, safe abortion, antenatal care, vaccination. These are key things that have helped the continent make progress in the last 2 decades, and we are at risk of jeopardizing those gains if we don't make the priority. But beyond the services themselves, communication and education are really, really key. Even when their services are made essential and made available, women may not know about them, and they cannot access the services like, family planning. Therefore, I think the ministers need to really ensure that there's wide communication through radio, through TV, through whatever channel there is. At the same, we're communicating about the virus and COVID and the response. We need to ensure that women and girls are aware of the service availability. This is also an opportunity to harness innovation. Many services that women and girls need can be safely self-administered, from medical abortion to family planning. So how do we use innovation to ensure services continue to be available for women? And we have good examples. For example, in South Africa right now, ministry has decided to decrease the burden from the public sector. So they are working with our partners to train private providers who have overwhelming services. And in fact, some of their essential services are non-essential, are deemed non-essential. They're working with them to ensure that reproductive health services are becoming part of the essential package. We're seeing a lot of innovation around telemedicine, where we're really keeping healthy people who need preventive services out of the overwhelmed health system by using telemedicine, by using innovation. So I think there is a real opportunity to expand on these things. And in addition, as I mentioned before, we cannot forget the secondary effects of COVID on women and girls. We are seeing enormous increase in domestic violence. Countries like France are separating women who have a history of abuse and putting them in hotels and protecting them. But in many parts of the world where resources are constrained, women are locked up with their abusers. So ministers really need to be considering how they can provide safe space, how can they provide both comprehensive physical and psychological service to address complex issues like domestic violence. And again, the highest toll, for example, in sub-Saharan Africa in COVID is being seen in Egypt and South Africa. And there is a lot of lesson to be learned in South Africa, where they have set up a hotline for domestic abuse. And I think just in the first few weeks, there were overwhelming number of women calling, complaining of abuse. So I think ministers have a very unique opportunity to set up programs that are responsive to women, that are integrated, and not just making the services available, but really also focusing in communication so that information goes out to women. One of the things that we need to see more and more is women sitting at the decision-making table. I think there was a very glaring picture that appeared early in the pandemic in the United States, where all the decision makers and or the people who are planning the response were men. And as much as male decision makers may be champions of these issues, women's voices need to be heard at the same table if we truly want to address their needs. So granted the fact I mentioned that 70% of frontline healthcare providers are women, we want to see more and more women being incorporated, their voices being incorporated. And I think ministers have a great opportunity to do this. Many of African countries are at the forefront of putting women in leadership position. There are many health ministers. There are, but then how do we ensure frontline providers and others, and they're not just there in their room symbolically, one or two. And at the end of the day, I think the pandemic is testing our commitment to the most vulnerable because they will be most affected by the virus and its secondary effects. So I hope we can prove that we are stronger and more resilient than this virus, and that it will require us putting the most vulnerable at the center and considering their needs first and foremost. And really my plea to the ministers who are really in the middle of this fight and who are fighting tirelessly and putting all their energy and resources into this is ensuring that they do this with keeping in mind that the most vulnerable people who are going to be the most affected need to be placed center right. And then also ensuring that women and girls do get opportunity to participate in the decision making.